So the next talk in this session will be Moses Kiti.
Glad to be here to present to you some of the work that we are doing to understand social contact patterns in Mozambique. But I'll be talking about this, first of all, in a general perspective, because we are doing this work in several countries. Then I will zone in specifically in Mozambique, where we have some data that we have collected and present some preliminary results. I think since end of 2019, this aspect of social contact patterns has really come out into the forefront again, and particularly with regards to the spreading of respiratory pathogens. In this case, we are thinking about SARS-CoV-2, but then also in context of others like influenza and RSV. So this flowchart that I'm showing here basically shows the kind of process that we go through in terms of starting from collecting our contact data up to how we use this data in mathematical models. So we have different tools and methods for collecting our contact data. Paper diaries are the ones that are most common and easy to use and deploy in larger populations for collecting this data. So essentially, you hand out people a sheet of paper and you ask them, who do you come into contact with, where, for how long, and how do you relate to these individuals, among other characteristics that you will collect from people. We also have telephone surveys that have been done, but then we've heard a bit about how there are some biases in how you would get data from telephones or randomly calling individuals. So you need to have people with telephones that you can call. You need to have people who can actually respond to the surveys. For example, how do you ask younger individuals in the household questions about their contacts? New technology that has come up include the use of proximity sensors that basically detect interactions or proximity interactions between two or more individuals. So you wear this kind of badge things either hanging around your neck or attached to your body, and anytime you come close to someone else, then it will detect that and record it as an interaction with someone else. Population mixing simulations also is being done, but this is based on a lot of assumptions regarding age and sex distributions in certain populations. And we've heard a lot about mobility data in the past session, so I will not go into that. So once you collect your data, then you want to understand these patterns. So this is why now you start doing your analysis. And the primary outcomes in these studies include mean contact rates. So how many people do you come into contact with in a day or over 2 days or over a period of time that you specify. And eventually the holy grail of this is the contact matrices that is normally used in mathematical models. So you have an n by n, a square matrix basically that tells you people of this age group interact in a certain manner with people of a similar age group or different age groups. And I'll give an example of this in the presentation. And because of differences in interactions based on age, sex, region, and urbanity, then you can start picking out different patterns that now you apply in your mathematical models that look at transmission of infections and how, once you understand how these infections may be transmitted, then you can now start understanding how you can control the transmission of these infections using different methods such as physical distancing, for example, which has been used mostly in the last couple of years. And this is normally done using compartmental models. So depending on the granularity of your data, you can either have compartmental models or agent-based models. So I'll briefly talk about our data that we have and how we can apply this in the models that I've mentioned here. So from the literature that has been there for, I think, about 20 years now, there are 3 key things that we have identified, and we are trying to fill in these gaps. So first of all is that contact patterns vary by world regions and even between and within countries. So one of the biggest studies that has been done so far looked at contact patterns in Europe, 8 countries in Europe, and they were able to show that even in that one region block, there were differences in patterns. For example, when you compare Italy versus the UK, you find people in Italy have more average number of contacts compared to the people in the UK. And these also patterns vary by other characteristics like age and family structure. So Having identified that, the other thing that comes up to the limelight is that there is little data from low and middle income countries. And to try to fill that gap, the data that has been collected in Europe has actually been used to model other areas like LMICs and also in the US. But thinking about our family structures, our patterns of interactions, then there's definitely a need to have data from these countries that shows the actual situation in context. And lastly, a lot of these studies have also not used standardized tools. So there is a need to have a tool that can be used in different settings, different countries that will actually ask questions in the same way, and also be able to collect data that can really show the situation, how it unfolds in all of these different situations. So to address some of these gaps, we have our GlobalMix project. So we are calling it GlobalMix in short, that collects data from 4 different countries. We have started our work in Mozambique in 2020. We are now collecting data in Guatemala, and then we'll move to India and Pakistan up to the end of 2024. We are collecting data using standardized tools and procedures that I will describe. But before we started this process, we had a formative phase, basically a qualitative exercise to ask people about their perceptions about the study. What do you understand is a contact? Can we actually use these tools in these settings? Do you accept carrying a sensor over a period of time? And also to basically boil down the logistics and procedures to be able to collect data in a more efficient and accurate manner. So I'll now talk about the 2 tools that we want to use. This shows a snapshot of a diary that we are using in Mozambique. We can see that it has actually been translated into Portuguese for ease of understanding there. We are asking about 5 basic questions in this tool. And then we have another longer questionnaire that we have developed in REDCap that expounds on this questionnaire. Essentially, what we are asking for this tool is, who do you contact? Where did you contact this person? And when and how long did you spend with this person? For individuals who cannot read and write, then they have a helper or a shadow, especially for children and those who, early literate. So we have these also visual guides that try to portray different age groups that are there in these countries. And actually what you're observing as you're moving to other countries, then they have different representations of these ages. So that's again in the aspect of contextualizing our tools for different populations. So it's definitely, well, not definitely, but it is possible to scale up this kind of diaries to larger populations because they are cheap and easy to give out to individuals, but they do suffer from recall bias. So thinking about this conference here today and how many people you come into contact with, and then at the end of the day, someone asks you, how many people did you interact with, who did you sit next to, then it may be difficult to remember all this information. So to try to counter some of these challenges, we have our second tool that we have been able to develop in the last 2 years. Of course, borrowing a lot from our previous study that is called social patterns that has been done mainly by a group in Italy. We have these sensors that can detect proximity between 2 or more individuals. So if you wear it the way you're wearing your badge right now, facing forward, then it's possible for it to detect any other person that you come into contact with. The good thing about this is they have been manufactured in the US, so they are FCC compliant. We are able to program them using a USB interface. It detects and logs proximity interactions, and we are looking at this face-to-face because we are thinking about respiratory infection spread. And eventually we want to make this open access so that any other research team that wants to use similar tools and methods can do that. So this shows our team in Mozambique. This is me wearing the sensor, and this is how it will look like wearing on being worn by a child. So we are recruiting entire households. Our focus is on an index participant age less than 5, and we'll collect data over 7 days and use that to identify network characteristics at the household level. So I will talk about our AIM-1 data from Mozambique briefly. So we have recruited 625 people between April and December 2021 who have reported 11,000 contacts between these like 8 12-month period, and we have registered very high mean contact rates of 18 with an IQR of, ranging from 12 to 24 overall. I will also show some of the other, breaking it down now by age, which is what is most important for us. So the red line here shows the median contact rates, and then we have the different age groups from the data that we have collected on the x-axis and the number of contacts on the y-axis. So we see low median number of contacts about 13 from children aged 6 months, which rises over this age up to around 24 in school-going children aged 10 to 19 years old, and then it declines again up to these individuals who are aged 60 plus. When we break that down further by certain characteristics like household membership, so are you a member of my household, or are you not a member of my household, we can see that we can start seeing these subtle differences. So for example, infants will have high contacts with the household members compared to non-household members, and this sort of interchanges as you move across the ages up to around 15 to 19 years old, whereby you have a lot of contacts being reported by non-household members or with non-household members, and this again declines as you move across the age group. Another factor that we are looking at is school enrollment. So of course, these 10 to 14 and 15 to 19 years are in school, so we definitely expect them to have higher contacts compared to those who are not enrolled in school. And lastly, looking at day of the week, comparing weekend versus weekday. So I think surprisingly, this is something that maybe I didn't expect to observe in terms of weekday versus weekends. So in African societies in general, you would expect more people having a lot of more social activities over the weekend compared to the weekday. But there are other confounders that we have to look at when analyzing this data to be able to explain why this is being observed as is. And lastly is a contact matrix, which I talked about earlier, looking at how people of different ages interact with other people of different ages. So two things that we can pick from this at the moment is this high level of associativity that occurs between people of the same age, picking people aged 10 to 19 years old, and also intergenerational contacts that essentially are contacts between infants and older people of the society who are their parents and the elderly in their households. So to conclude, we've been able to use different tools to collect data in Mozambique. Analysis for the sensor data is still ongoing, so I've not been able to show that. We have reported very high contacts despite, even during the COVID-19 pandemic in Mozambique. And the next steps will be to compare data in rural and urban settings, assess the drivers of these different contacts, and eventually use this data now in mathematical models to see how will these contact patterns influence transmission, and how can we use that to control the spread of respiratory infections. And lastly, make these tools and data available open source for other researchers to use. It's a big team, a big effort, so thanks to all our partners and collaborators for this project. Thank you.
Thank you, Moses. Yeah, we've got time for a couple of questions. What questions are there for Moses?
So something that really stood out was the difference that we're seeing in the numbers of contacts in this setting compared to earlier talks where they were talking in Texas or elsewhere. Is it possible to combine these different data sources so that you can adapt models for respiratory viral transmission using these different contact patterns in different settings so that you can have models that are more accurate in those settings?
So, I think it is possible to combine this data. So one of the things that we would want to do is we have two data sources. We have the diaries and we will have the sensors. So one of the things that we want to do is to compare and see how different are these contact patterns being reported by different sources. So maybe from there you can generate indices that can use to now make more generic contact patterns, data that can be used now or adapted into mathematical models that you would want to use. The other thing that you can also think about is how do you define the questions in your model? So if you're using a contact matrix, you have data that is more defined in compartments, for example, like different age groups. So you'll be able to define particular kind of models using that. But if you're looking at more granular data that has been collected using the network or portrayed by the networks using the proximity sensors, then again you can now develop more advanced models that will actually look at individual nodes and how their network interactions are in the network, and how you can now look at transmission and control of infections.
Last quick question, please. Yeah.
Hi, this seems like quite a lot of work to keep these diaries for the participants. So I wondered if you could speak a little bit about your incentives or recruitment and how they could lead to bias in your data as well.
That's, I think that's one of the things that is really understated in such kind of studies. So we had, for this particular study, we are starting first of all with a formative phase. So we are going out to the communities and asking them questions about, do you understand what a diary is? Are you able to remember your contacts? Can you fill this in on your own, or do you need assistance from someone else to fill it in? Essentially, a shadow who will follow you around and fill it in with you or for you for that duration of time. So to try to counter some of that potential biases in recording these diaries, we have been able to design these diaries based on feedback we got from this formative phase. So like the images you are using is based on the community's understanding of different age groups. The wording in the diary is based on feedback from the formative phase in terms of how they understand the diaries and how they want us to explain to them about how they work. We also ask them about who they want to be a shadow. You would want someone who you're comfortable with, that you can tell every interaction that you actually have without having a worry about expressing all your private affairs to someone else. And then lastly is data collection. We also have a red cap tool. So we have a field team that goes back and asks all of these questions now again to this participant, like tell us about your entire day, and then you record this line by line in a red cap tool. So we've tried to put in a lot of measures to try to minimize, to understand their perceptions, also to minimize a lot of these biases that may be due to collecting of these diaries. But I'm happy to discuss with anyone further after the conference. Thank you.